So as Tiglia mentioned, I'm really interested in figuring out how we can improve mental health and the delivery of effective mental health services in humanitarian settings. And by this, I mean people who have been exposed to war, disaster, persecution, and other human rights violations. We know that in humanitarian settings, the rates of mental disorder are more than 3 times higher than what we see in non-humanitarian settings. Despite this, services tend to be far more scarce and more difficult for these people to access. So almost 10 years ago, I was working in Somalia and visiting one of the 5 mental health treatment facilities in the country. All of these facilities shared one primary care provider who had some but very limited training in mental health services. In these facilities, patients were heavily sedated, lying on paper-thin mattresses in very overcrowded cells. People had been chained for years, to the point where there was one man whose muscles in his leg were so atrophied and the contractures made it completely impossible for him to walk or even stand. These facilities very much felt like prisons, not treatment centers. And, as we were moving through these facilities, one moment that really stands out to me is as we were leaving, there was a patient who shouted to us in Somali and basically said, "We need help, but they've all given up on us." And this statement has really resonated with me, and unfortunately is consistently what we see when we go to humanitarian contexts across the world. So people with mental health problems tend to be the first that are forgotten, the most marginalized, the ones that are given up on. And this has left me grappling with this question of why, when we as a field of global mental health have come so far, we have effective interventions, we have innovative strategies for delivering mental health services, why aren't we doing more to ensure that we get those services to the people who are most in need and the people who have the most limited access? Unfortunately, the global humanitarian setting has not gotten much better since the time I was in Somalia. In fact, we're now seeing unprecedented levels of forced displacement globally, with over 70 million people forcibly displaced worldwide. Something that might surprise you, however, is that the country that had the highest rates of displacement in recent years is not Somalia. It's not one of the countries that has received a lot of international attention. It's actually Ethiopia. So in 2018, there were over 3 million Ethiopians who were internally displaced, primarily due to conflict and climate change. And I think, just to put this in perspective, the number of Ethiopians that were newly displaced in 2018 was almost twice the number of newly displaced Syrians that year. So when we think about this, Ethiopia is actually a really interesting place to look at the effects and the challenges of working with communities affected by displacement in these types of emergencies. Ethiopia as a country is very committed to training. They've made a commitment to mental health and integrating mental health into primary care. They have a growing mental health workforce. When you look at the services that are available for the displaced communities in Ethiopia, they look very similar to what I saw in Somalia. And I think, given this burden, this was really what prompted our idea for this pilot award, where basically our goal, Dr. Faru and I, is to try and develop linkages between the displaced communities in Ethiopia and the mental health services that exist there. So through our partnerships with the government, the Ministry of Health, the Ethiopian Public Health Institute, as well as NGOs, UNICEF, and others, we have been able to map what mental health services are available in 3 communities that have been very heavily affected by displacement in Ethiopia. And the idea as we move forward is to figure out what are the barriers in these people accessing these services that are provided by the Ministry of Health in Ethiopia, and how can we develop a locally informed, culturally relevant referral strategy that can overcome some of these challenges. So we're in the process of doing that, and we're really excited because our partnership with the Ministry of Health has allowed us to potentially elevate the impact of this project, as they have agreed to integrate our referral strategy into a national mental health assessment that they have planned for later this year. So I'd love to talk more with you about the details of the project later during the poster session or at any point today, but I want to just say thank you so much on behalf of my partners in Ethiopia as well as at Columbia for your support and helping us make these initial critical steps towards improving mental health among displaced persons in Ethiopia. Thank you.